So, hello student. I hope all of you are doing good, and I hope all of you uh, had a great time in exam. But the feedback that I'm getting from many students that the exam was a little bit harder side. But when I was looking through going through the physiology questions, in my subject I didn't find that much difficulty. Although you may tell me better that whether the questions were tougher or it was simpler. But before that, um, just give me a thumbs up whether I'm clearly audible and visible at your end or not. Anybody, if you're there, just give me a thumbs up whether I'm audible and visible at your end. Okay. 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 Thank you. Thank you, Dr. Krishna, Dr. Priya. Thank you. Thank you so much for the confirmation. So we are going to start the session. What we will do in this session, we are going to discuss the answer. Best possible answer, because I'm not going to discuss the detailed explanation of the question, because I know this is the time when you want to listen the answer of the question, correct answer. What is the correct answer, sir? I don't want to listen what is the explanation, right? So that's why we'll finish up the session. So how to start physiology for the first year. So this is not the session for you. I'm absolutely sorry. So here we are going to discuss the INI-CET recall question. So before the starting of the session, this is the disclaimer. Okay, all of you know all the questions that we are going to discuss here, that is the recall questions and recall by students only. So if you think that any questions is not the exact question, so you can give your feedback in the comment box so that I can update the questions, and later on the updated questions will be shared in the PrepLadder group, right? So that is the motto of this session. So we are going to start the session directly. So this is the recall session for INI-CET May 24 exam, right? Okay. So the first question is coming in front of you. So let me ask you, so what answer have you given in these questions? So what is correct about the depolarization of the cardiac muscles? So depolarization of the cardiac muscles, all of you have read that the action potential of the cardiac muscles is like this, and there are different phases. And in these different phases, all of you know this phase number 2, this is also known as the plateau phase. All of you know this, okay? So this is known as the plateau phase. And because of the presence of the plateau phase, I told in my classes that the action potential duration of the cardiac muscle is very, very prolonged, right? Around 300 to 400 milliseconds. And whenever the action potential is prolonged, you know, the absolute refractory period, or you can say refractory period, will be very, very long, right? So large refractory period, this is a true statement, right? Tetany, this is not possible, okay? Then all or null, obviously the cardiac muscle behave like a functional syncytium, all of you know. And whenever you stimulate the cardiac muscle, the whole muscles start contracting simultaneously. So this all or null law, it's follow all or null law. That's also a true statement. Length tension relationship, yes, this is also seen in case of cardiac muscle. So there is a comparison in my lecture that cardiac muscle and skeletal muscle length tension relationship comparison is there. So this is also true. But tetany is not seen in case of cardiac muscle, you know, because of this long refractory period. Tetany, okay, tetany development is not seen in case of cardiac muscle. You know, there is a very pet question in INI-CET examination that calculate the tetanizing frequency of the skeletal muscle. So whenever we ask you for calculation of the tetanizing frequency of skeletal muscle, okay, we never ask you to calculate the tetanizing frequency of cardiac muscle, because in cardiac muscle the action potential duration is very, very prolonged, and because of the prolonged duration of the action potential, you cannot produce tetanization on cardiac muscle. So that's why the answer of this first question is tetany. Which of the following? Okay. What is correct about the depolarization of the cardiac muscle? So this is true. Okay. This is also true. This is also true. So obviously there is multiple question, but I hope you have noted that the question has been asked whether it is accept or only the choose the correct statement, right? So if it is accept, then it is B. Otherwise, if you have to choose multiple choices that which of the following are correct, then I already told you that A is correct, C is also correct, D is also correct. So B is not correct, right? So according to your question, Sir, tetany was not the option. So what is the option? Could you recall? What is the option? Could you recall? Possible? Or question was accept or not accept? You have to choose multiple. Appropriate question would be incorrect option. Okay. So if I add accept, that is the correct question, I hope, right? So rather than this correct, you are saying that incorrect, right? Very good. So if I add accept here, then my answer will be the tetany B, right? Tetany was there. Okay, very good. So now I got it. So obviously it is not a multiple choice question. So if you recall that which of the correct, so all three are correct, but only the false statement here is the tetany. So either choose the incorrect option regarding the cardiac muscle or all except type of questions. Anyway, so if it is incorrect, right? I believe that it was incorrect because some of you told incorrect. Okay. So if it is incorrect, then your answer will be B, right? Or if it is choose multiple correct answers, so already told you A, C, and D is multiple correct. Okay. No problem. Okay. So detailed explanation is there, but I'm not going to the detailed explanation why tetanus development is not possible because of the long refractory period. Okay. But exact mechanism will take much of the time. So I'm not discussing here. Now coming to the second question. Another question which I believe the recall is not appropriate. So in response to increased blood pressure, SA node is influenced by which of the following? Could you, okay, multiple correct होगा तो A, C and D. Could you recall what was the question here? SA node related some question was there. It could not. Okay. So if this is the exact stem of the question, then this is a kind of twisted question, you know, because here it is saying that increased blood pressure. So we all know that increased blood pressure and SA node. Okay, was key when BP increases, which neurotransmitter is released from SA node. Obviously, not from SA node, but released at the level of SA node, you meant to say, right? So, in the increased blood pressure is saying which neurotransmitter is released at the level of SA node. Very good, very good, very good. In response to increased blood pressure, which neurotransmitter released at SA node? Very good. Thank you for the recall. Exactly. Act or released at the released will be the better because all of them. Okay. So now look at. So all of you know that whenever the BP is increased, it is going to influence or it is going to stimulate your baroreceptor. And whenever your baroreceptor is stimulated, all of you know that it is going to stimulate the nucleus tractus solitarius, NTS, right? And from here, the signal goes to the cardiac inhibitory center also and the RVLM, rostroventral-lateral medullary center also, which is also known as the vasomotor center. But all of you know that rostroventral-lateral medullary center will be inhibited and CIC, cardiac inhibitory center, which is the center for parasympathetic center, this will be stimulated. So this RVLM is connected with the sympathetic system. So basically, whenever your blood pressure is high due to any cause, the baroreceptor will be activated and that will inhibit the sympathetic system and that will stimulate the parasympathetic system. Now, all of you know that if you stimulate the parasympathetic system, it is going to influence at the level of nodal tissue and the neurotransmitter which is going to be released is the acetylcholine. So this is the correct answer in this question. Okay. All other neurotransmitters, so this epinephrine, norepinephrine from the sympathetic ending at the level of nodal tissue will be decreased. So that's why this is not going to be my answer. So most probable question is absolute good recall. I should say that increased blood pressure leads to which neurotransmitter release at the level of nodal tissue, right? Very good. Yes. So this is the answer of this question. I hope all of you got it. Okay. So now we are not taking much of the time here. Next question. A decrease in GFR is associated with which of the following? So four condition was listed. You have to choose which decreases the blood pressure. Sorry, GFR in this condition, right? So this is again an easy question. All of you know that the net filtration pressure for the GFR, okay, that is a PC, hydrostatic pressure of the glomerular capillary minus PB, okay, hydrostatic pressure of the Bowman's capsule plus oncotic pressure of the Bowman's capsule is a helpful for the GFR and it is inhibited by oncotic pressure of the glomerular capillary. So this is the equation all of you know, right? So now if you look at here, number A, increase renal blood flow. So it will increases the PC, hydrostatic pressure. So net pressure will increase, GFR will increase. Increase glomerular hydrostatic pressure. Just now we have discussed that it will increase the net forces, right? So decrease Bowman oncotic pressure. So if this force is decreased, right? So this Bowman oncotic pressure is a helpful force for the GFR. Means if the Bowman oncotic pressure, Bowman's capsule oncotic pressure is high, then it will try to drag fluid from capillary, means GFR will increase. So obviously, if there is decrease in the Bowman's capsule oncotic pressure, the GFR is also going to be reduced here. So the GFR is going to be reduced here in this condition. So I have to choose this C. Decrease glomerular oncotic pressure. If this is decreased, then obviously the GFR is going to be increased in this condition, right? So this is not going to be my answer. So A, B means obviously the GFR is going to be increased. Okay, only the C answer is possible here. I think the options was like this. So obvious question, if you just recall this equation, you will be able to answer. But obviously, exam mein kya hota hai na, even the simplest things you cannot clarify there in the, because your brain will be blocked by multiple thinking, right? But here the answer will be C according to this option, right? Any comment here? I think options, okay, C is different. Okay, C was different. C option was not there, sir. Okay, so what are the option? Anything related to Bowman's capsule hydrostatic pressure? So if there is also increase in Bowman's capsule hydrostatic pressure also, okay, increased Bowman's hydrostatic pressure. Hydrostatic pressure can also be an answer. It was decreased renal blood flow, then that is an answer. Increased hydrostatic pressure in glomerulus, not. Increased Bowman's oncotic pressure, not. Decreased oncotic pressure of glomerular capillary, no. Okay, then either the decreased renal blood flow or increase in hydrostatic pressure. These two can also be answered if it is present in the option. Now I will tell you, all of you, try to recall whether this increased renal blood flow was there or decreased. If it is decreased, then straightforward, that is your answer. Okay, there is no absolute. Okay, it was decreased renal blood flow. Okay, so all of you are saying, so then if it is decreased renal blood flow, then that is also going to be your answer. Okay. Okay, increased blood flow. That's why I'm saying, okay, it may not be that much simple. Okay. Anyway, so I told you in this questions, if these are the option exactly same, then C is the answer. Otherwise, other two answer that is also possible here, decrease this or increase hydrostatic pressure. It can also be answered. Okay. So I believe this decreased renal blood flow was not there according to other recall from student. Yes. Only the third option. So third option, the other third option possible is increased Bowman's capsule hydrostatic pressure. That is also possible. Anyway, let me know which was the correct. Completely opposite, which was decrease the RBF. Okay. Possible, because this is also recall question from some students only. I don't know what was the exact, because increased Bowman's capsule hydrostatic pressure was 100% sure. Okay. Because I have seen in some of the groups, some students are saying that increase Bowman's capsule hydrostatic pressure. So if it is there in place of this, then it can also be your answer. It can also be your answer. Okay. Anyway, don't fight in the chat box. Okay. Look at the next question. So in the next question, it is pretty simple. Okay. So erythropoietin is secreted by. Okay. Obviously, kidney is the main answer, but multiple choice answer will be there. Okay. And sometimes when you are looking at the muscles and the heart muscles, you may be confused that maybe erythropoietin is also secreted by muscles. But if you find out literature, then muscle contain erythropoietin receptor, but muscle is not secreting erythropoietin. Same way, heart is also not secreting erythropoietin. But major secretion is around 85 to 90% secretion is from kidney, and 10 to 15% secretion is from liver. Okay. In my lecture, I told you that it is the, the perivenous hepatocyte of the liver and the peritubular capillary cells of the kidney. Those are the cells which secretes erythropoietin. Okay. Even if it is heart in place of spleen was there. Okay. Okay. I'll change it. Spleen. Okay. So spleen is also not the answer. Okay. Muscle is also not the answer. Only two options are possible. That is liver and kidney. So A and B is answer here. This is the answer. Okay. So mainly it is secreted by kidney, but they are not asking here mainly. They are asking erythropoietin is secreted by major source is kidney. There is no doubt, but liver also secrete erythropoietin, right? Okay. Now, which of the following are typically associated with lower motor neuron disease? Now, only kidney now. Liver is there. Perivenous hepatocyte also secrete erythropoietin. Okay. Okay, no issue. So, which of the following are typically associated with lower motor neuron disease? That's the multiple correct options answer question was there. And this is easy question, straightforward. So, atrophy, severe atrophy is seen in case of lower motor neuron disease, as well as fasciculations is also seen. But deep tendon reflexes increase. This is seen in the upper motor neuron lesion. Okay, upper motor neuron lesion. And rigidity is also feature of the upper motor neuron lesion. Okay. So this is a kind of correct, table that I have shown in my lecture that fasciculation is present in lower motor neuron disease, tone is decreased, stretch reflex is absent or hyperactive, and there is severe atrophy is present. Okay. So these, based on this table, the question has been asked, but this question is, I know all of you know the answer because in medicine also you have to read the same topic, and in physiology also you have read the same topic. Okay. Upper motor neuron, I don't think students are saying that lower motor neuron they are asking. So what do you think in this group? Okay, they ask you about the upper motor neuron feature or lower motor neuron feature. Which of the following are typically associated with the lower motor neuron lesion according to my questions here? Upper motor पूछा था. Okay, which is not present in upper motor neuron. Okay, ठीक है, उल्टा हो गया, डबल नेगेटिव हो गया. Okay, which is not seen in upper motor neuron lesion, right? So obviously upper motor neuron lesion not seen in atrophy is generally not seen. Diffuse atrophy may be seen, and fasciculation is not seen. Again, the answer remains same. Okay, so atrophy and fasciculation is the single best answer. Although upper motor neuron atrophy can happen, but that is diffuse atrophy, not the upper motor neuron lesion per se. So इसलिए I believe that not seen in upper motor neuron lesion. Again, your answer will be atrophy and fasciculation. ठीक है? ठीक है? Okay, no sir. So see, it's difficult to recall the exact question. Okay, and whenever you are handling 200 question in upper motor neuron, which is seen, and there is rigidity and increased reflex. Oh my God, you are saying exact opposite question. Upper motor neuron lesion seen. ये क्वेश्चन था बोल रहे हो. Okay, single option. Anybody? Do you agree with what you are saying here? That in upper motor neuron, which feature are seen? There was rigidity and increased reflex. Now here, the rigidity and increased reflex both are seen in the upper motor neuron lesion. Very difficult, huh, sir? But multiple tha. Okay, okay, okay. So anyway, I hope you got the answer that upper motor neuron lesion seen. Okay, then your answer will be this C and D will be the answer. Okay, C and D. Okay. Yes. Okay, chalo. Next question. Okay, next question. So in this question, there was an image, I believe, na? So students are saying that EEG is showing K complex, identify the stage of the sleep disorder. So obviously, all of you know that the K complex and the sleep spindle, both are the feature of the stage 2. Okay, stage 2 non-REM sleep. That all of you know. Okay. In stage 1, you know that there is theta wave, and stage 3 there is delta and REM sleep. There is beta-like activity. So you know the images. Their images was given. Obviously, images was given. Now, okay, got it. So images not only the EEG. Okay, so images was the complete images of the polysomnography. You mean to say that, na? That electro-oculography also image was there. EEG also there, and also EMG also there, right? See. Okay, very good. Sir, REM का था. नहीं, obviously this is not the picture. This is the K complex picture. But students are saying that the K complex picture was there. But now you are saying that नहीं नहीं, के कॉम्प्लेक्स का नाम नहीं था, दैट आई नो। के कॉम्प्लेक्स का नाम दे देगा तो क्वेश्चन कैसे होगा ना, वो तो इजी क्वेश्चन हो जाएगा। आई एम आस्किंग ओनली द के कॉम्प्लेक्स पिक्चर वाज देयर, और ईओजी, ईईजी, ईएमजी पिक्चर वाज आल्सो देयर, दैट आई एम आस्किंग। ऑब्वियसली के कॉम्प्लेक्स देके क्वेश्चन क्यों देगा, दिस इज एन इमेज बेस्ड क्वेश्चन। सो recall from your students only, right? So RAME tha, so you didn't find any K complex in the question. Okay, okay. So there was EMG, EEG. That's absolutely correct, right? Now, did you identify that EEG is of RAME type? Okay, because in RAME, the most significant feature is there will be silent EMG. The EMG will almost look like this. There will be a single line, and onto that line there will be some disturbance like this. This kind of EMG recording will be there, and that is the identifying feature of the REM sleep. If you are saying that REM sleep is the answer, and EEG in the REM sleep, there will be high frequency, small wave will be there. Okay. No, 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 no. EOG का movement था, EMG flat था. Okay. So I am changing here that EEG first movement was there and EMG was like flat. Okay. So in that cases, if you are getting EMG like flat, then most probably it is an REM sleep. Okay. But obviously, if you ask other students, okay, this is the recall from students only, that K complex like feature was there. Okay. So don't worry. Obviously, maybe your recall is the correct one. Okay. And this is not the correct recall. Exactly. Recall is very confusing, particularly when the polysomnography imaging is given. Maybe you are looking only at the EMG. Maybe someone is looking at the level of the EEG and say is finding out something. So don't make confusion. Okay. Because exact identification of the image or recalling of the image from the exam is very, very difficult. But I believe that EMG based question can only possible either you can detect the non-REM sleep stage 2 or you can detect the REM sleep also. Because in REM sleep, there is a significant feature that is the EMG will be flat. And in non-REM 2, stage 2, the two features are there, that is the K complex and sleep spindle. This is also the distinct feature in the EEG. So that way, either it will be REM or either it will be non-REM stage 2. That is for sure. Okay. 100% I remember that picture. Okay. K complex. See here. See, Dr. R is saying that K complex was there. So, and just 2-3 students were there that it was sure that EMG was flat. So that way I'm saying he don't get angry, right? Okay. You have marked correctly. But these questions I have got from students who said that it looking like the K complex over there in the EEG. Okay. So if it is K complex, then sure shot non-REM stage 2. But if it is flat EMG without any K complex, then obviously REM. Okay. Next question. Now, this is a question the anatomy teacher will discuss. Okay. So spinal nucleus of the trigeminal is associated with which of the following sensation? Pain and temperature is the answer. Okay, in this question. So I'm not taking detailed discussion here because it's a answer of the question of the anatomy, right? Next question, which hormone does not play a significant role in utero growth of fetus? So is this the question? And options, look at the questions or option. क्या लग रहा है आपको? So options, cortisol was also there. Okay, which hormone does not play a significant role in fetal growth in utero? Okay. IGF was option rather than growth hormone. IGF in place of does not play. Question was does not play. Okay. If the question is which hormone plays significant role, then the main hormone for the fetal growth, insulin. Okay. So it has significant role. This is true. Okay. Main hormone. In place of cortisol, IGF was there. Okay. Here he repeat growth hormone. Okay. Thyroxine. Insulin like growth factor. Okay. So if it is IGF, then obviously you have to choose this growth hormone, because mainly the growth hormone mainly effect is in the postnatal growth. Okay. But if cortisol is there, then the cortisol is the single best choice, because cortisol has growth inhibitory effect. Growth inhibitory effect. Okay. Otherwise, if it is IGF, so IGF also has one of the main roles. Second best role is the IGF. Okay. So insulin IGF तो बिल्कुल ही नहीं होगा. Thyroid has significant role for the maturation and differentiation of the fetal tissue. So growth hormone mainly for the postnatal growth. बोला जाता है कि after 36 week of gestation, growth hormone action started. But again, if cortisol was there, then the cortisol has no role, because rather than cortisol has a role, rather than it has growth inhibitory potential. Okay. So that way cortisol will be the answer if it is there, or if it is not, then growth hormone. Okay. Sure. Next question. PIQ. Okay, go. Now next question, select the correct sequence. Okay. So here the question is about the G protein couple receptor, GPCR. Okay. G protein couple receptor. So GPCR, if the effector is the adenylyl cyclase, then all of you know the adenylyl cyclase is going to produce the CAMP, and CAMP is going to act on PKA, protein kinase A, right? But there is another effector molecule, that is the phospholipase C, okay? And it act on the, this GPCR act on the protein phospholipase C. Phospholipase C produce IP3 DAG, okay? So this IP3 releases calcium, and this DAG act on the protein kinase C. So these two things you have to remember. But here the question is about the adenylyl cyclase. So obviously adenylyl cyclase stimulating CMP, CMP is stimulating protein kinase A. B will be the correct answer. Okay, no, पहले adenylyl cyclase आएगा, because that is the effector of the G protein coupled receptor. Okay, whenever G protein coupled receptor is activated, the alpha subunit will be detached from the G protein, and then it will act on the adenylyl cyclase, and then it will produce the CMP followed by the protein kinase A. So this sequence is correct in option number B. So that's why it is the answer, right? Okay. So next question, label the given image. So again, an image. I don't know whether this is the correct image, but when I first time look at this image now, मेरे को भी थोड़ा सा confusing लगा था, right? Because in 1 and 2, anything can be 1 and 2, okay? Then it is coming to pituitary. From pituitary, it is coming something. Then I'm finding out that it is acting on the liver. Now, whenever I find out liver, then I came to know that this is going to be the growth hormone. So this growth hormone will be placed here, okay? And growth hormone, when it is acting on the liver, it will produce the IGF, okay? And this IGF has inhibitory effect on the hypothalamus also, as well as on the pituitary also. And same way, this growth hormone also has inhibitory effect, okay, on the pituitary and hypothalamus, right? So this growth hormone and IGF is detected. Now, all of you know that for the growth hormone secretion from pituitary, okay, there are two influences from hypothalamus. One is the positive influences and one is the negative influences. So negative influences is obviously the somatostatin. So obvious thing is that this one is going to be my negative influences. So this is somatostatin, and the positive influence is going to be my growth hormone releasing hormone, right? So negative and positive was there. Okay. Liver पे IGF था. Okay, so IGF was already there on the liver. Okay, very good. Very good. Then it is absolutely sure that this 1 and 2, this will be somatostatin and growth hormone releasing hormone. So somatostatin and growth hormone releasing hormone. And then 3, which is released from pituitary, that is going to be my growth hormone. And the growth hormone is producing IGF. Now, other factor that is given here, it is not directly related by the growth hormone, but the ghrelin is a stimulus for the growth hormone secretion. So that way it is given that from the stomach, ghrelin is released. Okay. Ghrelin भी था, ये ghrelin is there. Okay. Acha, ghrelin was there. You have to choose. Okay. So ghrelin has stimulatory influence. So anyway, so this was the actual image. Basically, I believe that the ghrelin is here. Okay. Okay. So ghrelin is a stimulus for this hypothalamus as well as the pituitary for the growth hormone secretion. And the growth hormone is inhibited by somatostatin, stimulated by growth hormone releasing hormone. Growth hormone acts on adipose tissue. It causes lipolysis and free fatty acid produces, right? So this was basically the image, I believe. and the correct option will be A, right? So this is the endocrine question. And the last endocrine question, this is not the exact question, but I believe that in the images, this was labeled with A, B, C, D, like this, okay? And you have to choose that which section produces which hormone. So this is pretty simple image, and I believe that all of you have done it correctly. So first layer is the zona glomerulosa, that is going to produce your aldosterone. Second is the zona fasciculata, that is going to produce the glucocorticoid. Third is the zona reticularis. And the fourth one is the medulla, that is the epinephrine secretion. Obviously, there will be multiple options. The option will be like this: A, so A like this, B, C, D, this kind of option will be there. Okay, I have not written that. Okay, so again, A something will be there, B something will be there, C something will be there, D something will be there. Okay, so this kind of multiple option will be there, I believe, right? Easiest question, yes. So that's why I have not written the options here, but this is pretty simple question and different layer and different hormone from them. Okay, so okay, okay, thank you. So this is all about the physiology MCQ that has been asked in last INI-CET examinations. Around 10 to 11 questions purely from physiology have been asked. But my view is that questions were on simpler side. Okay, there was a little bit confusion in some of the questions, but that will always will be there. But if you look at the previous questions of INI-CET 5 or 6 years ago, the questions were all more difficult side. Okay, nowadays the questions are getting simpler. Okay, okay, okay. So yes, thank you so Dr. R. So if you can send me the picture of the exact images, that will be very, very good. So this is my WhatsApp number, 888-250. Okay. So this is my WhatsApp number in the chat box. Okay. You can WhatsApp me the correct image. Over attempting question. Over attempting question is, revision is required. If you don't revise properly, you will think that every questions, the answer that you are thinking is your correct answer. And that way, it's a temptation in the exam hall that whatever I'm thinking, that's a correct intuition and my thinking is correct. And that is the reason why student marked over answer, okay, in the exam hall. So that way you have to be sure that whatever you are thinking, your intuition is correct or not. And how to differentiate that? Only the revision, okay. So we have to revise more and more. Otherwise, 50% option to exclude हो जाता है. But exclusion between two options is very, very crucial in exam hall. And most of the students, they jump on the answer that they thought that whatever they are thinking in their brain, maybe they have read somewhere and their thinking is correct. But believe me, most of the cases that is not correct. Okay, and that is the reason why you do so much of mistakes. Okay, and later on you think that ये क्यों मैंने आंसर मार दिया, ये नहीं मारना चाहिए था. Okay, okay. So I have shared my WhatsApp number here. Please, if you recall the correct question with correct options, please share me in the WhatsApp. I'll be more than happy. So this is all for today's session. Thank you so much and best of luck for your exam result. This is all for today. Bye bye.